So you're very welcome to our session today on exercise and heart disease, where we go through what type of exercise you should be doing for your heart health, particularly if you're at risk of a cardiac event or you've had a cardiac event already. So we learn quite a bit through the session today. So when we look at exercise, quite often it's mistaken for physical activity. So physical activity is movement that's carried out by the muscular system that requires energy. So really it's any bodily movement. So it's getting up off the chair, it's hanging out the washing, it's washing the windows, standing rather than sitting. So that's physical activity, and you can accumulate that up over the day. So quite often people misinterpret the 10,000 steps in activity for a structured exercise program. In order to get the physiological benefits from exercise, your exercise needs to be planned, it needs to be quite structured, and it needs to be very intentional, and there needs to be a repetitive movement. So the reason for that we'll go through later, and it should become clearer to you why you need to do this structured piece. It also improves your fitness levels, and that really means that it improves your capacity to produce energy. And we're really looking at swimming, combining that, or examples of structured exercise might be swimming, although that's very high MET level, cycling, walking, and then you're going to incorporate some resistive work into your regime as well. So just to bear that in mind as you're working through your sessions. So why should you exercise if you have heart disease? So we know that with exercise training that's specified for you specifically and individualized for you, we can reduce your risk of a further cardiac event or first cardiac event by 31%. So it's quite marked. That's quite significant when you look at some of the other benefits, maybe from your some of the medications in isolation. Exercise is a singular intervention that will really improve your quality of life. So it's important that you're combining both the medical side of your management with exercise training and cardiac rehabilitation to optimize your performance so that you're getting the full benefit from your intervention or the medication that you're on. So how does it work? So what we're looking at really when you're looking at exercise training, you really need to understand what happens to the heart when you're actually increasing your myocardial workload. So you're increasing the work rate of the heart in response to either activity or a structured exercise program. So here we see on your diagram here that we see what we call systole, which is contraction, and we also see diastole, which is relaxation. Now with the coronary arteries, what happens is get a nice contraction here, so the coronary blood flow is significantly reduced. It starts to uptake again during diastole, and then it starts to tip off again during systole. So you can imagine as you're squeezing the heart, you're not actually going to be able to get much blood flow in through the coronary arteries. So the coronary arteries have to dilate quite a significant amount to get enough oxygenated blood to the myocardium. So that's very much worth considering as time goes on through your exercise program. Initially, when you're exercising, what happens is your heart rate increases. So with that, you see the time in diastole reducing. So there's lots of adaptive mechanisms that occur in the coronary arteries to help the blood flow, and that's really centered around widening the artery. Over time, what happens with exercise training is your heart rate comes down. So in essence, as the heart rate comes down for a given workload, you're actually looking at increasing the time in diastole, so increasing the perfusion time of the coronary arteries. So the amount of time it has to actually get the blood through and deliver the oxygen down to the myocardium. That's exactly what this pink part of the slide says. So when we look at the coronary arteries, or the arteries around your body, they have similar structures. So what you're looking at really is as your exercise training, what you're starting to get is this nice shearing force on the wall of the artery. As that shearing force continues, we get this nice release of nitric oxide, and we start to see that the vessel dilates quite nicely. So within the coronary arteries, as we mentioned earlier on, that widening will actually improve the flow of blood through the coronary arteries, but also the nitric oxide affects the arteries around your body. So as your arteries around your body become more and more dilated, what you're starting to see is that the resistance the heart has to push against becomes less. So in doing that, you're starting to reduce the workload of the heart. So that takes a period of 6 to 8 weeks to achieve that increased nitric oxide release and the vasodilation that comes with that. When we look at exercise training, we know that it positively affects the efficiency of the muscle. So the muscle is much more efficient at taking up the oxygen and converting it to what we call ATP, but energy, so that you're able to work harder for less cost. And this is how we improve myocardial efficiency. And in other terms, that's really reducing the workload of the heart for the same level of activity. And this is it in a more diagrammatic form. And we start to see, when we look at energy production, we start to see you're breathing the oxygen in from the air. I'll just change the color of the marker there, in from the air here. That comes into your lung tissue. From the lung tissue, it's diffused across into your circulation, passes through the heart, and off we go down through your system, and then on into the muscle. So it's down here in the muscle, in this little mitochondria, that we actually start to see the energy production. So any interruption in that flow will reduce the capacity to deliver down to the musculature, but also down here what we need to start to look at is how can we make the muscle more efficient. So even if there is reduced oxygen, we can actually optimize our performance, and that really is when we start to look at some strength work. So it's important you're combining the cardiovascular work with strength work, and that certainly will optimize your performance, offloading the heart, reducing the myocardial workload, and improving your mortality. So here, when we look at the correct way to exercise, we look at the FIT principle. So that's the frequency, the intensity, the type, and the time. So for the frequency, it should be 3 to 5 days a week. You do need to take 2 days off your training regime as a recovery point, so that's important to note. The intensity, so you'll be given your heart rate training zones from your heart-to-heart physios, and you'll be able to work within that. Now, before you go into these zones, it's important you're doing your 15-minute warm-up and then your 10-minute cool down. So in total, you're working the 15-minute warm-up. You're going to work 20 to 30 minutes of the conditioning phase, and that's within your training heart rate range, and then graduating down nice and easily for a cool down for 10 minutes. So the reason behind that is that during exercise you get a release of adrenaline, noradrenaline. We want to taper that down nice and gently. So we start to do the 10-minute cool down is very important, as it reduces your risk of any funny rhythms of the heart. So please ensure that you do that. So if you're late to an exercise class, it's important that you start off with a warm-up, even though you might be delayed within the group. And then on the other side, it's important that you cool down appropriately. So if you have to leave a little bit early, start the cool down yourself a little bit early. There we go. So that's your frequency there. So we've covered that already. So when we look at the intensity, it's important that we're looking at, why is there a training heart rate zone? So when we look at our exercise capacity, we have two different metabolisms, or two ways of producing energy. So we use the anaerobic system and also the aerobic system. So initially when we start to work, we use for 2 to 4 minutes, we start to use the anaerobic system, and we're very inefficient in our production of energy. So it's 2 ATP, or 2 energy molecules per glucose molecule are produced. We then move into what we call aerobic metabolism. So that's using the oxygen to produce energy. You can see that that goes right up to 34. So we want to stay within that range during exercise. At a certain point, we start to build up some waste products. So we're going slightly above capacity. Within the aerobic, we're coming into what we call the lactate threshold. So this is when we start to go back into anaerobic metabolism. We're starting to build up waste products again. So when we look at your prescription, this is your training heart rate zone that we look at. And that actually equates to 40 to 70% of your heart rate reserve. So that's calculated from your chest or step test. And that's quite specific to you. So you can certainly get guesstimates if you like in around it, but what you're looking at is it's very specific for you if you're doing the testing yourself on your medication. That's your training zone there. So this is what your session should look like. You've got your 15-minute warm-up, which is nice and what we say graduated, so you're coming up nice and gradually, and you're just finishing at your training heart rate lower zone here. We quite often just give you one number, so that's your target. If you maintain that for your 20 minutes, then we start to graduate down again, just flushing out any of the adrenaline and noradrenaline. So in total you're looking at pretty lengthy phase of training, but that'll work quite nicely for you, and it'll optimize your benefit for the exercise training, because certainly what you don't want to do is to invest a lot of time in exercise and not optimize your capacity to improve your performance. So we need to look at the type of exercise as both resistive and aerobic type exercise. When we look at exercise, we look at a MET level. So as you're resting, nice and relaxed, sitting in the chair, fully supported, that's what we call 1 unit of energy, or 1 metabolic equivalent, or 1 MET. So when we exercise test you, we can be quite specific in advising as to whether you can go back to a particular type of activity, and that's related to your MET readings from the test that we've done with you. So these are the levels. So if you've done the testing in your house, we're actually on the lower level there with it. So you'll have remembered where you are on each step for the testing. As you progress through our programs, then we'll increase the step height as you have more access to us, hopefully, as time goes on. So just to give you an idea about the METs, so we know for gardening, obviously the more vigorous it is, the higher the MET capacity that you're required to do it. So just clearing, brushing is 3.5 METs, and then mowing the lawn is 5.5. Then much heavier work will move into a 6.3 on the MET scale. So if you want to look at, what you scored on your test versus your MET, it'll just give you an idea of what you shouldn't be doing at the moment, before you can. So if you pull back a little bit from that activity, look at an exercise training regime, you should eventually be able to do that particular activity that you want to get back to. These are some of the household activities. So you see here the carrying the groceries upstairs if you're living in a flat or an apartment. You're looking at the actual stair climb is quite vigorous on its own anyway. So that's 4 to 5 METs. And then if you're carrying heavy weights, that'll bring it right up to 7.5. So that's equivalent to playing squash, or just slightly lower level squash. And it's much heavier than moving furniture. So just to bear that in mind when you're doing household activities. So this is your walking. So for your walking, your 3.5 METs is 2.8 to 3.2 miles per hour on the level. As you start to increase, add in a little bit of incline, the MET level goes up, and your speed of walking with that as well. So walking 5 miles per hour on level ground is 8.3 METs. Quite a good intensity. So I hope we cleared up a couple of your questions today on exercise and heart disease. Certainly we'll be sending you a specific email regarding your training zones, and we hope that we see you at our cardiovascular training sessions. So thank you for your kind attention.